All right, today we're going to talk about something well, it's one of the most remarkable stories of our time, the global fight for child survival. It's this incredible story of success, for sure, but it's also a story about the huge challenges that are still out there. Okay, let's get into it. Let's just jump right in with a number, a really big one, 56%. That's the drop in deaths for children under 15 since 1990. I mean, think about that. That is one of the biggest wins in the history of modern public health.
But what does a number like 56% actually mean? Well, it means we went from over 14 million kids dying in 1990 down to just over 6 million in 2018. That's millions upon millions of children who got the chance to actually grow up, all because of decades of hard, focused work around the globe.
So yeah, let's dig into that victory first. Let's really understand how this incredible story of survival even happened. Okay, before we go any further, there are two key terms we need to get straight. First, there's mortality. That one's pretty simple. It means death, and it's how we measure the overall health of a population. But then there's morbidity, and that's all about the illnesses and developmental issues that can really impact a child's life, even if they do survive.
So, how did we do it? I mean, how did we pull off such a huge drop in mortality? What was the actual turning point? The answer is surprisingly simple.
It really was a clear cause and effect. It all started with the absolute basics: better sanitation, cleaner water, more food. And just doing that led to a massive drop in infectious diseases. Then, on top of that, we added the incredible power of vaccination campaigns. You put all that together, and it just created this tidal wave of change that brought death rates way, way down. So you hear all that, and you think, great, the fight is over, problem solved, right? Well, that's where the story takes a pretty sharp turn. See, the challenges didn't just go away, they've completely changed. And this brings us to the new front line in this fight. We really need to understand what the biggest threats facing children are today. And here's a stat it's pretty sobering. Get this, 47%, almost half, of all deaths of children under 5 happen in the neonatal period. We're talking about the very first month of life. This is where the battle is now. So why is that first month so incredibly dangerous? Well, the main culprits are being born too early, preterm birth, and complications during delivery. And, these are not problems a simple vaccine can solve. This stuff requires really solid healthcare for both moms and their newborns. Now, if a child makes it past that first fragile month, the picture changes. Things like pneumonia and diarrhea are still huge killers, but look at this. There's a quiet giant in the room: undernutrition. It's a contributing factor in a third of these deaths. It's the hidden threat that makes every other sickness so much more deadly. Okay, so this gets us to a really important idea. The diseases themselves are kind of like the symptoms, but what are the root causes? We have to look at what's really driving these numbers. I mean, check this out. Look at the infant mortality rates in two wealthy European countries. The UK's rate is way higher than Sweden's. So what does that tell you? It tells you that just being a rich country doesn't automatically fix the problem. Something else, something deeper is going on. So what is that something deeper? Well, this quote, it just spells it out perfectly. A quarter of infant deaths in the UK could be prevented if you just got rid of the risks that come with poverty and deprivation. The takeaway here couldn't be clearer. Inequality is a killer. It really all starts here. Poverty touches everything, from the food a family can afford, to their housing, to whether or not they can get to a good doctor. It is the absolute foundation of risk. Then, of course, there's maternal health. A mother who is healthy, who is well-fed, and who has access to great medical care during pregnancy, she gives her baby the absolute best possible start in life. It's that simple. And finally, you have to look at the child's environment. Things like war, natural disasters, and the growing threat of climate change. All of this creates chaos and instability that makes children just incredibly vulnerable. So, what does all this mean for the future? As more and more kids survive those dangerous early years, they're growing up to face a completely different set of challenges as teenagers. The battlefield has totally shifted. Back then, it was all about fighting infectious diseases, and we got really good at it. But now, the new threats are things like non-communicable diseases, injuries, and the growing crisis we're seeing in mental health. And this is a really tough reality check.
For teenagers, the top causes of death are no longer things like pneumonia or malaria. Now it's car accidents, other kinds of injuries, and tragically, suicide. These are problems rooted in our modern environment, in behavior and in mental well-being.
And it's not just about who lives or dies. For those who do survive, we're seeing that morbidity, remember that word, is on the rise from chronic conditions. Things like obesity, asthma, and diabetes are creating lifelong health problems that begin when you're just a kid.
Which leaves us with this final massive question. We learned how to save children from infections. We figured that out. But how do we save them from inequality and from despair? The tools that got us this far, the vaccines, the sanitation, they aren't enough for this next fight. The challenges ahead are so much more complex, and they're woven into the very fabric of our societies. Figuring this out, that's the unfinished work for all of us.